So we're joined by Minister David Ashford for Health and Social Care on our weekly catch-up. I'm in for Paul. I've just come back from university and I thought it'd be a good chance to have a catch-up with the Minister. I've just finished my 2 weeks isolation. It was all good, and I did get checked on my last day, which was pretty good.
Excellent, I'm delighted to hear it.
There was something about it though I thought was quite interesting, is that they don't check for any ID or anything. They just sort of come to the door and just check your name off. So in theory, if you had a sibling or something else in the house, they could come to the door and say you were them, and there'd be no way they could check.
Yeah, I mean, at the moment, obviously, it's all household isolation, so you would expect the entire household to be isolating. And if they're checking on one person, with the whole household isolating, I would expect they should check on the entire household. Of course,
yeah. So obviously, we're recording this on Monday, a breaking story about the TT being cancelled. Firstly, your reaction to that?
Well, obviously, I've known as a minister for a while there's been planning in this. We can't be certain where we would be in June next year. So I think it's right for the Department for Enterprise to make the decision now so that we can move forward with planning for potentially later in the year.
And did you think it was the right decision to completely pull it this year and not even push it to the end? Maybe lump it with MGP and Classic TT in the summer?
I think the right decision has been made. I think that, obviously it's going to upset a lot of people, the decision, but I think that the right decision has been made because we really just don't know where we could potentially be.
I mean, do you think there's a risk of, this now be the second year in a row TT will be cancelled, there's a risk of interest falling off the sport with 2 years in a row cancelled? Do you think there will be the international interest that there was if it's been cancelled, for 2 years in a row?
Well, obviously there's a potential that some people might lose a bit of interest in it, but actually you could have the opposite as well, where, for instance, there's more interest. When TT was cancelled after Foot and Mouth, we all remember the following year, from my memory, was a bumper year for TT, with people coming back into the island, able to celebrate it. We need to be responsible around our decisions, and although it'll be a blow to a lot of people, the announcement that's been made today, it is important that we do what we believe is right, and it wouldn't be fair to keep people hanging on when we know that there's a potential that it can't go ahead.
So we're now in end of November. I'm just curious in terms of timelines. If you had to rate morale in DHSC in the hospital, 1 being terrible, 10 being amazing, how would you rate it?
I think it depends on which area of DHSC. I've always been quite blunt about that. I think there's some areas of DHSC that have very high morale, there's some that have low morale. If I was doing a general rating, I would probably rate it about a 6 or a 7 at the moment.
So why would it be a 6 then?
I think in relation to, say, 6 or 7, I think there's some areas, the transformation's coming online as well. People have been rushed off their feet with COVID. I think across the health service people have done an absolutely fabulous job, but it has been exhausting. And we've also got to remember, with border restrictions, people haven't been able to travel quite in the same way that they would previously, see family that's abroad and loved ones, and that puts strain on people, particularly when they're working in high intensity jobs, which they are doing in DHSC.
But surely though, it's arguable that the strain on a lot of staff members has also come from COVID, but also from management. And many people feel that the bullying accusations that were made within DHSC. I mean, you've put morale at 6. I mean, that's quite disgraceful, surely, that we're just above halfway on morale.
No, but I think morale is something that needs to be built upon. That is precisely why I've had a focus as Minister on the culture in DHSC. And, of course, we commissioned the Sir Jonathan Michael review around things that need to be changed. But we have to recognise these things take time. You can't go from day one of having one particular culture to having a brand new culture the next day.
They take time, Minister, but I think Paul's been asking the question of, how would you rate it in his famous sort of way for quite some years now, really, with morale. I mean, it's been staying at a stagnant level for quite some time. You would accept that, surely?
Well, I think it has remained stagnant for quite some time, but I think we are now building upon it. I know a lot of the staff personally. Being a small island, we all get to know each other, and staff have come forward to me and said they do feel there is now a culture change occurring in DHSC, but it's going to take time to embed.
I'm sure they write you many letters as well for that matter as well.
They do, and I only hang on to them as long as I need to.
So, if I wanted to purchase a private COVID test, how much would I be charged for that test?
So the private test is £50, which covers the cost of processing the test and actually the on-costs of staffing the test.
I think I'm right in saying there is also another on-island private testing facility which you can get. Am I right in saying that?
There's several, I believe.
And they're quite considerably more than £50 from what I'm hearing as well. why is government undercutting the private sector for what is a commercial test that is not needed for a public health matter?
We're not undercutting. The reason the test has been made available is we've been made aware of numerous occasions where, because the tests are processed in the UK, people haven't been able to get the turnaround for travel. So, for instance, I was contacted by a couple who did order a private test, but you've got to have the test valid within 72 hours of travel. The test wasn't able to be processed in time, so they then couldn't go on their trip because the test wasn't there even available. Or it came back, or if they booked it earlier, it would have come back too early and wouldn't have had the 72-hour validity. In DHSC terms, we are only charging what is the actual cost of the test to us.
I mean, what was quite interesting was Dr. Rachel Glover, your best friend, she put a tweet out last week stating, she was not aware in supplying the testing agents that they were going to be sold for, private patients, essentially, if you want to call it that. I mean, she was not under the impression that, I appreciate you're selling it at cost price, but she sold to you at cost price under the assumption it would be used to roll out to the Isle of Man testing, not for private individuals. I mean, your reaction to that?
Hang on, the £50 was also in place for 7-day in test. So this is no different.
But she did argue differently on that. She did say that was for the economic benefit.
Also, we don't just get reagents off Dr. Glover. We order reagents from other companies as well. So we have a mix of company reagents. We do order ones off Dr. Glover, but in terms of pricing, that's a matter for our supplier.
No, absolutely. But so the reason why you're providing this test is more for the turnaround of people.
It is. We've been contacted by numerous individuals and businesses as well, where people have to go on business travel, where they have been unable to get to the country of destination because the private test hasn't been able to be done within the time frame required, and it is now having an impact on people. And
just staying on testing for a second, you're going to tell me there's plenty of capacity at our testing facility. Guernsey last week introduced day 13 testing to get that data. Will you now follow Guernsey and introduce a day 13 test?
Maybe not day 13, but there are plans to look at introducing surveillance testing. But at the moment, of course, there's also the legal issue because you would have to potentially mandate people to take the test in order to, and you wouldn't, and also people wouldn't take the test unless mandated if there's no benefit to them.
Plenty of other countries have this sort of level of testing to get that data. What we're seeing in Liverpool, for instance, as well. I admit
that's voluntary.
I know, but my point is that I think it demonstrates people. I think actually, if you spoke to most people, they would be happy to take a test. I would argue.
Well, actually, I'm fully aware of people that haven't. The 7-day in test, for instance, wasn't taken up by everyone, even although that actually offered different freedoms. So you will find an awful lot of people, particularly people you've experienced the test, a PCR test, and it's not a pleasant test to take.
No, it's not.
For instance, we offered PCR testing to key workers. Well, we had a lot of key workers who came forward and had the test once. Once they'd had it once, they didn't come back again.